25% of the body's bones are found in the foot.
Wow, 25%?
Yeah, absolutely.
What is the qualifications and education that a podiatrist goes through?
A podiatrist,
What does a podiatrist do?
a lot of people don't realise, we study the lower limb. So everything from the hips down. It's not just the foot and ankle, hips, knees, the whole way down. So it's the study of the lower limb. It's always better to visit your podiatrist prior to that foot pain becoming really problematic. So if you jump on it straight away, prevention is always better than cure.
When do you suggest using an orthotic or a custom designed? And what is a custom design?
Welcome to the Comfort Walk and Talk, where every step towards comfort is a step towards a healthier you.
We're your hosts,
Jeff.
Allanah.
And Ben.
Together, let's transform our lives from the ground up. Well, hello everyone. Welcome to the next episode of Comfort Walk and Talk, brought to you by the Comfort Co. Really most common things that I hear in our businesses, when we talk about our business being founded in podiatry, we often hear, well, what does a podiatrist do? And so we thought we'd do a special episode today with Sophie, who we've had many times, and just talk about really what does a podiatrist do and demystify it for our customers. So Sophie, welcome to this episode.
Thank you. Thanks,
Welcome
Jeff.
back,
Thanks
Sophie.
for having me. Happy
All
to be
right.
back.
And as you know, Sophie has a lot of experience in podiatry. Her and her husband have built a really big practice around children's foot care and all that, but we're going to talk in general about podiatry today.
Yep,
It's one of
perfect.
the only
Sounds
children's
great.
podiatrists in Australia, right?
Yes, correct. Certainly the only one in Queensland, and there's only a small handful of them around the country in Australia. So
Feel free to throw in a plug if you like.
Little Big Feet.
There you go.
Little Big Feet. What a great name. That is, eh?
Excellent.
Little Big
Yeah.
Feet.
As a marketer, I appreciate that.
Yeah,
Thank
it's
you.
a lot
You're
of
welcome.
It's a great name. All right, first question, and this
Yes.
is something that is misunderstood a lot, is what is the qualifications and education that a podiatrist goes through?
Yep, okay. A podiatrist studies typically an undergraduate degree at university. So they'll study for 4 years as an undergraduate. There's several universities around Australia, down the East Coast and over in Perth as well. Some podiatrists do enter as postgraduates, so they might have studied something previously, like a science degree or perhaps nursing or something like that, and then they've gone across into podiatry. But certainly it's a 4-year qualification regardless. A lot of those undergraduate degrees are called like a Bachelor of Applied Science or Bachelor of Science in Podiatry. I know Perth over there, theirs is actually a Doctor of Podiatry, so they come out actually called doctors. Ostensibly it's the same undergraduate degree, but yeah, just the semantics
Is that the same
around
amount
it.
of time or?
Same amount of time.
Yeah, right.
Yeah, same kind of thing. So it's just all the semantics around it. But technically if you're along the East Coast, you're not a doctor, but you have done your 4-year qualification.
So I hear in the US, just following up in the United States and even in Australia, there is a qualification. There's a podiatric surgeon, or is there,
Yes.
there's a small selection of surgeons as well as
Yeah, that's correct, actually. There's only a handful of those in Australia.
Yeah.
I'm not sort of up to date with exact numbers at this current time, but they certainly are doctors there, and they're studying the podiatric surgery pathway. So that's entirely different to
Podiatrists in
itself.
general don't do really operations and so forth.
No,
like that.
correct. That's exactly right. But as podiatrists, we're not doctors. I guess you could call us scientists because
Yeah.
you study an undergraduate degree in a type of science.
Okay.
Yep.
Okay. And it would make sense that there's that much education around it because it is one of the more complex parts of the body, isn't it? It's the foot.
Yeah, absolutely. So 25% of the body's bones are found in the foot.
Wow, 25%.
Yeah, absolutely.
Wowee.
And there's over, I don't know, you've got 26 bones in the foot, over 30 different joints in there, and over 100 muscles, tendons, ligaments, and so forth feeding into the foot. So some of those intrinsically within the foot and others which are extrinsic, which feed down into the foot. So given the array of structures, joints, muscles, tendons, ligaments, and so forth, there's a lot of stuff that can go wrong within the foot and ankle complex itself.
I had no idea. There you go.
So
Very,
you would
very
do a lot
complex.
of X-rays.
Yeah, when it's warranted.
Yeah.
Yeah. Try not to expose people to unnecessary radiation if we don't have to. But certainly when it's warranted, X-rays are
That's
done.
phenomenal though. So it must be pretty hard to sort of identify where a particular issue is with the foot.
It can be, and I guess that what makes it incredibly hard as well is we've got such a huge amount of like sheer vertical force going through the foot and ankle itself as well. So when you're out there just walking at a brisk pace, it's about twice your body weight going through the foot and ankle complex itself. And then that increases with velocity. So then if you start to run, then that's about 3 to 4 times your body weight. And even more again with jumping. So there's a lot of forces. There's lots of scientists, lots of podiatrists and so forth out there, biomechanists and whatnot that study the vertical impact, through the body. but there's a lot of shear force going through the foot and ankle, so plenty that can go
So would
wrong.
you say a podiatrist, one of their key sort of objectives is to provide a really good foundation for your foot so that it doesn't get injured? Is that?
Yeah, definitely. Prevention's always better than cure. So as a podiatrist, usually people come to us when they've got a complaint or an issue. But if we can educate the patient, direct them towards the right footwear or right features and things that they might need to look for, then definitely you can lay the right foundations to prevent injury and so forth.
Another thing that really often gets a bit confused and we get asked questions about is physiotherapist, podiatrist. Tell us a little bit about how you see the difference.
Yeah, we get asked that a lot as well. A really common one would be someone might have knee pain and they would say to us, should I be coming to you or should I be coming to the physiotherapist? It's a really good question because there is a lot of overlap. So as podiatrists, we study the lower limb. So everything from the hips down. A lot of people don't realise that it's not just the foot and ankle, hips, knees, the whole way down. So it's study of the lower limb.
So just on the lower limb, where does that start again? Is that
Hips.
From hips?
Yep, hips
lower
down.
limb.
Yeah.
Hips. Okay.
Yep.
Because everything works together, right? So, if your alignment's off, then with your foot, then it's going to hurt your knee, you're going to hurt your hips. And so that would make a lot of sense as well. But I didn't
Absolutely.
realise that.
I did not realise that you go up to the hips.
Yep, definitely. And I guess it's then about finding out, deciding what's the right treatment pathway for you. So for example, if as a podiatrist we assess someone's knee pain, which we can absolutely do, and then we decide that's more to do with muscle imbalance or overuse or soft tissue injury or something like that, then that's when we'd probably say we're going to send you off to a physiotherapist because they can do your rehab program and oversee all of that. And similarly, a physiotherapist might assess knee pain and say, you know what, this is coming from foot and ankle. We need to look at that. We might need to go down orthotic therapy, that kind of thing. And so then they'd refer across to the podiatrist. So wherever you start, it doesn't really matter. You should end up in the right spot.
Okay. So you think physio is more likely to be sort of doing muscle therapy and recovery like that, and whereas the podiatrist is more about prevention?
I'd say they're both sort of really are about prevention. But when you go through and study, I'd say your physiotherapists probably do a lot more on that rehab side of things, certainly like injury rehab and so forth. And obviously then they don't really do too much at all in the space of orthotics and so forth. So that's when they would just push them across.
So they usually refer to the podiatrist for the biomechanics type aspect of the orthotic.
Yeah, definitely. Yep.
Okay.
So what kind of conditions would you guys treat and which ones would you send off to the physio?
Well, ostensibly anything that we know we can correct from the foot and ankle position, we would certainly be doing that ourselves. And even some of those acute soft tissue injuries, so it might still be soft tissue, but if it's something that we need to perhaps put into a moon boot or, stabilise or protect for a period of time, we can definitely do that. But if we see some advantage to some sort of rehabilitation program and so forth, then personally I would be sending that to the physiotherapist to get their guidance and follow through on that.
So for example, say I broke my ankle. Mm-hmm. And needed to shattered it. It's awful. Oh my word, what a terrible accident. And I need to get it. That would be more a physio sort of thing because they could do that rehab program there.
Certainly for the rehab side of things, I would say yes. That initial assessment, you might end up at a podiatrist because you might go, foot's just ballooned out. It's huge. It's so sore. I had this accident last night at footy, whatever it was. So a podiatrist can send you off, get the x-rays.
It was the ballet actually.
It was the
ballet.
The ballet, yep. Well, absolutely, we can send you off, get the x-rays done, diagnose that, and then we might be saying, you know what, you need to be in a moon boot for 6 weeks anyway because you've fractured X, Y, Z. Then after that period of time in the boot, all right, we need to get a rehab program. You've lost a bit of your muscle strength and bulk. Let's tee you up with this physio.
So those moon boots actually work because they you have to stay in them that long.
Oh yeah, 100%. It's a great way of immobilising a joint. Yeah, it's amazing.
It's an alternative. I couldn't deal with it.
Yeah, well, it's actually great because it's an alternative to a plaster cast. Effectively, you're just immobilising the joint or whatever you're needing to immobilise. The thing is, you can take them off. So compliance can be an issue, but you can shower and you can do all these normal things, and then you know.
But they just meant to stop movement of the joint.
Yeah.
Is it?
Yeah, that's right.
It's the worst thing about a cast, isn't it? It's the old baths with your leg in the air sort of
Not
thing.
great.
And you want to do the itch and you put the ruler down
These
there.
ones can come off, so that's helpful.
Okay, so we talk about you mentioned earlier orthotics, and again that's when do you suggest using an orthotic or a custom designed, and what is a custom designed insole versus just the one you buy down at the sports shop or the...
Yeah, that's a pretty good question because we would get asked that often. I guess given the array and complexity of the foot and ankle itself, it makes sense that someone would have a customised orthotic because everyone's foot shape, structure, is entirely different. A customised foot orthosis controls the foot in multiple planes. So we're controlling the rear foot, forefoot, midfoot, and so forth. It enables us a lot of control, offloading, whatever we're looking for, we should be able to achieve that in multiple planes of the foot. Whereas with an off-the-shelf orthotic or off-the-shelf inner sole, generally they're more, just broadly speaking, more focused on pressure relief or pressure redistribution. So if you've got excess pressure under the forefoot, the heel, the lateral border of the foot, then we're just redistributing that to create more comfort for the patient. So rather than functionally trying to change everything, we're just sort of more redistributing the pressure. And
makes sense, yeah.
Sometimes I say to people that ask this sort of a question, like, which one should I be doing or which way should I go? I guess there's no harm in trying an off-the-shelf device first.
Yes.
They're going to be a whole lot more economical.
Yeah.
In fact, a fully customized orthotic, a pair can be, you might find some around for $400, $500.
Yeah.
Otherwise, they're upwards of $800, $1,000 for a customized orthotic. Whereas you can get something off the shelf for, $80, $100, something like that.
So just on that topic, because I sort of get what you're saying, that if you want to control, you're probably best to know what you want to control.
Correct.
Rather than just putting something in that is a general purpose, and there's plenty of good reason for the general purpose. But when you talk about orthotic and $800 to $1,000, is there any sort of health funds or how does that work?
You're not going to get any sort of Medicare rebate on a pair of orthotics.
Okay.
You can on the consultation side of things, but not a pair of orthotics. But if someone's got private health insurance, then dependent on their level of cover and their fund, then absolutely they should and may well have cover for orthotics. Whether it's the entire amount or part, they'd have to check with their health fund, but definitely that's where you'll get your funding. With
an orthotic, it's they've probably gone to you for a reason. They've probably gone to you because they've got some issue.
Yeah, correct. And then, that's our responsibility then to determine what the cause of that problem is. Doesn't mean that they're necessarily always going to need an orthotic, but we can absolutely identify what is the cause of that heel pain. Is it related to their gait, their mechanics, and so forth? And, if so, can a functional orthotic correct that, to alleviate that presenting complaint?
So what would you say are the biggest reasons why someone should see a podiatrist?
Oh, there's so many of those. They might come in for more dermatological issues such as ingrown toenails, warts. Perhaps they're a diabetic patient with neuropathy. They might have a diabetic foot ulcer, or it could be more mechanical sorts of things.
What is neuropathy? That's another question that we get asked all the time.
Yeah, that's more like when you've got numbness in the foot and legs. And typically that commonly affects a lot of diabetic patients. Yeah, and so that's something then to be very mindful of for patients with diabetes, because if they lose some sensation or ability to feel in their foot, then they might not know when they've stepped on something, when they've got something in the bottom of the foot, when perhaps they've got an ulcer that's, growing in size, especially if they can't see underneath their foot, they may not even be able to feel that.
If someone has diabetes, are they recommended to go to the podiatrist?
100%. Yeah, definitely. So a lot of doctors and diabetic nurses and so forth will put diabetic patients on sorts of care plans to make sure that they're getting like routine checkups dependent on the severity of their diabetes and how well they manage it, just to make sure that the podiatrist is assessing the neuropathy, making sure things are stable, not getting any worse, and also helping with their general foot care as well.
How do they check for neuropathy?
They use little things called like monofilaments, which is a little sort of 5-gram filament, and we're just testing the patient's ability to feel sensation in the area.
Like a little...
It's almost like a little fine wire sort of probe that you just press against the skin in certain areas, and we're testing different dermatomes or different nerve pathways to sort of see if there's sensation in those areas.
And then they say, I can feel it or not.
Yeah, they're just like a yes-no sort of test. Can you feel it? Can't you? Eyes closed. So, and then other sorts of sensation as well, like vibration with a tuning fork and things like that too, that we're just sort of testing hard, soft, their ability to differentiate between different sensation. Yeah.
You mentioned before warts and ingrown toenails. I was under the impression that those were just sort of things you sort of just dealt with, I guess. But
how do you deal with that? Just
at home?
Pull it out and kind of deal with it, and it hurts. But that's what, because I've gotten ingrowns quite regularly, and I've never gone to see someone about it ever.
I got them cut out by a podiatrist years ago.
Yeah, right. Does it get rid of them a lot quicker, or does it need to be a particularly bad one, or like?
Well, in my opinion, an ingrown toenail, the sooner you get on top of it, the better. So I'll start with the ingrowns. Some people might go to a doctor as a first port of call because it might look like a red and inflamed. And actually a lot of podiatrists, in fact, the vast majority, aren't prescribing podiatrists, so they won't actually be able to prescribe antibiotics because they don't do that sort of pharmacology component in their undergraduate studies. However, that has been introduced in more recent years. But because they can't get the antibiotic, they might end up at a doctor. But a doctor, you're still not treating the main or initial or offending sort of spicule of nail that's caused that problem in the first place. So you can take all the antibiotics that you like, but if you don't treat the cause of it, then you're not going to get any resolution. So a podiatrist is the place to go do for that. There's a couple of procedures. If it's your first time with an ingrown toenail, they'll just resect down the side, generally speaking, and sort of clear away that offending piece of nail. However, if it is more chronic, something that's quite a recalcitrant ingrown toenail, then what they'll tend to do is perhaps recommend something that's called a partial nail avulsion or a total nail avulsion, and that's from the partial is more common, where we just remove a piece of nail down the side of the nail. And then we often use a chemical called phenol, and it sort of kills or retards any growth at the nail matrix. So then it will never grow back in that spot again.
Wow.
So you're sort of preventing ingrown toenails from happening in future. It's a minor surgical procedure, you would call it.
Okay, so that's if you get ingrowns in the same spot quite regularly.
Yeah.
Go and see your podiatrist.
Go and see your
Putting the nail
podiatrist.
out the
Fix
past.
it.
Yep.
Wow.
Getting rid of the nail, eh?
See you
Yeah.
later. No, I love that.
And it's often like your teenage boys,
Yeah.
and then they just can't get rid of it. And then as soon as you treat it 1 week, the next the kid steps on it at school, the next they kick a soccer ball and it's flared up again. So yeah, they're the sorts of ones that you're like, we've got to fix this once and for all.
So another question, often when we started this, people see podiatrists, the ones that don't sort of understand, they see it as someone that does nail cutting and all that. But what are some of the advances that you've seen in podiatry that have changed the industry a little bit?
Over the years, yeah, I guess more recently, the advances have been around technology and AI sort of in that space. So certainly there are some advances by the way of laser therapy and so forth, but a lot of them more in that tech space.
What do you use
like,
laser therapy for?
They can be used on fungal toenails.
Okay.
Yep, some soft tissue
With
conditions.
sharp
and so
light
forth.
killing it, is it? Or?
Yeah, ostensibly that's sort of it in a nutshell. Yep, killing all those fungal spores. But then a lot of the improvements we've probably seen a lot in the more recent years around gait analysis software, and then scanning software as well, the ability to sort of read the plantar pressures throughout the gait cycle and so forth, and then even the introduction of 3D printers as well.
Can you explain to our listeners what a gait is?
Yeah, good.
Oh, gait, as in GAIT.
Yeah.
That sort of gait, not the GAT gait.
Yeah.
So a gait cycle is just someone's movement cycle,
Okay, yeah.
I
Right,
suppose,
okay,
is
yeah,
what
yeah.
you would call it. We call it a gait assessment. So that assessment while that person is moving through all those different stages of their gait, of their movement. So we're looking at everything from heel contact to toe off to the swing phase, that entire cycle.
Okay, yeah, perfect.
Very good. You mentioned 3D print and AI and all that. So how are custom insoles made now versus where you see them?
A lot are still made in either on-site labs or sent off to labs by podiatrists. Probably the more traditional way of making things, particularly customised orthotic, was back in the day. It was always you take a plaster cast of the foot, so you're capturing the foot in the position you want it to be in.
Okay.
You get a positive of the foot. You're trying to recreate the foot effectively, create a whole mould of the foot. The same as when you go to a dentist and you would have gotten a mouth guard. It's like a mould of your teeth. And then orthotics are made in a lab that way. However, there has been, in more recent years, there's certain CAD-CAM devices and things like that, like milling machines that just spit out orthotics from a scan of the foot itself. And then people are playing around a lot in more recent years with 3D printers as well, which is still very much in its infancy. It's a lot of a slower process. Yeah, and it just depends what we're trying to achieve and I guess the materials we're able to use.
Okay.
So you said your specialty is pediatric podiatry. Say that 10 times fast, by the way. That's a fun one there. Are there other specialties? There
are just 3 that are recognised by the Australian Podiatry Association. So that is paediatric podiatry, sports podiatry, and high-risk podiatry, which is more your diabetic foot care, things like that. And so they're the 3 that are recognised by the Australian Podiatry Association, and they require that sort of additional study. I guess you'd call it postgraduate because you do it after you are a podiatrist, once you've already been working in the field for a number of years. And yeah, I guess it's a growing sort of area. It's something that's newer within podiatry to have these specialties. And certainly I think numbers are still relatively low. If you hunt around, you should be able to find someone that's got that sports qualification or that pediatric qualification.
As podiatrists, sort of, would you ask them what your specialty is, or are they general?
I think actually it might not necessarily be their specialty which they've studied, but certainly there's podiatrists, and some of them do very different things. So if you're out there looking for a podiatrist, my recommendation is find out what that podiatrist's interest or what they generally treat is, because some podiatrists out there are fabulous with more palliative care. So we're talking nail care, diabetic ulcers, your corns, your callus, that kind of thing. And they might not see many children at all. One might come through a week or something. They might not see much by the way of mechanical podiatry. But then you've got other podiatrists out there that just work with effectively like all within that sports realm. They do heaps of the rehab side of things. There might be a physiotherapist in there as well using a room. So they work collaboratively with the physio. And so that's a better person to see if you've perhaps got heel pain or a sports injury or something like that. So definitely it's worth asking the question, am I coming to the right podiatrist for this?
Do most podiatrists have websites?
Yeah, most of them do.
So they would probably say what they're interested on their website?
Yep. Definitely. Yeah. If you are looking for a podiatrist, there's a great website, podiatry.org.au, and that's the Australian Podiatry Association. And there's on there you can actually search. There's a little tab up the top that says "Find a Podiatrist," and you can actually search for a podiatrist within whatever radius of wherever you live, and then you can also include there what area of interest or specialty you're looking for.
Just on top of that, with the cost of living becoming a bit more of an issue, does that search bar have who they're covered by?
No, you'd probably need to call them, but you should be able to call any podiatry clinic and ask exactly that. So if you've got concerns about cost of consult, how much is it going to cost if I end up needing orthotics, you should ask all those questions up front, and they should have no worries at all in sharing that, divulging that information with you. And then, of course, if you do have a private health fund, definitely beneficial to ask that podiatrist, can I have a code for the consultation? Can I have a code for the orthotics and so forth? Because then you can call your health fund and say, hey, am I covered for this code and this code and this code?
Okay.
Yeah.
So that would just be private. Do you guys get any coverage from Medicare at all? Or?
With Medicare, people have to be referred. It's much like going to the dentist, I suppose. So you're not covered with Medicare unless you're referred on what's called an enhanced primary care plan, and a doctor can give you up to 5 visits a year on that, in which case you would get a Medicare rebate.
That's good to know. And what kind of conditions would someone qualify for that?
To qualify for that, you have to have a condition that is obviously going to be affecting your feet and lower limbs or your ability to care for them. So, for example, someone could have quite severe rheumatoid arthritis in their hands and therefore they can't cut their toenails. Well, then they should qualify for that EPC. Right. But your GP is the best person to ask.
EPC, is it?
EPC, yeah, Enhanced Primary Care Plan, or team care arrangement as well. But definitely your GP is the best person to discuss that kind of thing with.
It's sort of answered in that question, but I guess what would be your general sort of position in terms of why people should care? You know, what's the real issue about caring for your feet? It's
probably the preventative angle, really, given the complexity of what's happening in the foot. As I said before, you've got over 100 muscles, tendons and ligaments down there. You've got over 30 joints and so forth. The more that you've got somewhere, the more that can go wrong. And so if you are educated in regards to how to look after your feet, what to look out for, especially if you have somewhat compromised in your health. So whether that's just because you're elderly, you might be compromised with the vascular system, you might have some neuropathy or nerve damage or something like that. The earlier you can get on top of that and make sure you know what you're looking out for and how to look after your feet, then certainly the better.
It's probably a recommendation, like you do the dentist, to have a podiatrist.
Absolutely. Well, I think probably it's not generally necessary when you're young, fit and healthy, unless there's a complaint. Yeah. But probably by the time we're starting to see any compromise in our health, so if there's some heart disease, if there is perhaps someone is pre-diabetic, something like that, then certainly it's worthwhile just getting a baseline measure with your podiatrist. They might say, I only need to see you once a year. Just pop through, we'll just stay on top of things, make sure nothing is deteriorating and so forth. Yeah. But the GP should always be that person that holistically is going to look at your health and say, you would benefit from this and from this.
So you did mention that someone would have some issues with their hands and they can't trim their nails now there. And I hope this doesn't offend you. I'm sorry, like in advance. What's the difference? Could you not just go to like a salon to do that?
Yeah,
like
a nail salon. Yeah.
I'm a man that loves a mani-pedi, so like I don't know. Should I be going to the podiatrist? Or?
This is a very good question because, and look, I don't want to diss a nail bar over here because there is nail salon. Yeah, but because there is a place for them. What I would probably say is that generally the people that need their nails cut because they can't attend to it themselves are generally elderly people. There's not too many 30-year-olds or 40-year-olds that can't cut their own toenails and take care of their own nails. So generally then it's the elderly people that also are compromised in their health too.
Yeah, you should probably be getting some advice from you while you're there.
Well, look, I can say that there are some very stringent measures and protocols around autoclaving and sterilising of instruments within the podiatry field. I'm not sure if they're the same. But I can't comment because I don't know if they're going to be the same, certainly in the nail salon. But of course, the last thing you want is to be 75, you're maybe diabetic, you turn up to a nail salon, perhaps they haven't sterilise their instruments how we want it, and then you've got an infection and something that then can just deteriorate from one thing to the next, potentially ending up with an ulceration, potentially losing part of your toe or something like that, when that could have quite easily have been prevented.
Yeah, so those massage chairs at the nail bars just aren't worth it.
Maybe for another time.
Kind of summarise here as well, we kind of jumped over right at the start. Let's hear it from you. What does a podiatrist do?
A podiatrist can look after anything from the hips down. So we effectively specialists in the lower limb. So any sort of afflictions, symptomology, any sort of presentation affecting the lower limb, you can absolutely have your podiatrist assess that for you.
Perfect.
Amazing. That's really intriguing, from the hips down. And so do you recommend do you see patients where you recommend that they maybe should go and get their hip checked or their knee checked?
We would probably more so see that perhaps in a child that might be in-toeing, for example, would be a nice easy example. And that in-toeing may be due to internal femoral rotation or rotation at the hip level itself, not simply just the foot turning in.
Yeah. I'm going to squeeze one in just at the end here. We have a lot of our shoes have kind of been developed with podiatrists. What kind of things would you put in a shoe? What does that mean?
I guess we're always looking for the right shoe for the right patient. So, for example, if someone is a diabetic, then they're going to be looking for soft features that aren't going to be no stiff, hard leathers, things like that are going to dig in, potentially
seam
cause
free
problems.
And things like that.
Yeah, minimal seams and stitching and so forth. Whereas if someone's got really nasty, painful bunions, then we're going to be looking for something that's going to be softer, perhaps a neoprene or a soft upper that is adjustable across the forefoot.
Like Revere.
So, yes, exactly. So matching the right shoe with the right foot is definitely the way to go.
Perfect.
Actually, it's an interesting. Whenever I talk to podiatrists about shoes, one of the tests they always do is they do this. They bend the shoe in
Yes,
a U.
yeah.
Now you never walk like that. So why do you do that for?
Generally, we're checking for the integrity of the shoe. So if a shoe should only bend where the foot's going to bend, which is like at the ball of the foot.
Yeah.
So then we want to know that the rest of the shoe is structurally stable.
Okay.
So definitely testing for the integrity, and especially if we're looking for a supportive shoe, then we want to make sure that's not a shoe that we can scrunch up into a ball, because that's probably not right for that patient if we're looking for support.
Fair enough.
Perfect. Yeah. Well, thank you very much for that, Sophie. That was really, really great, really insightful about what a podiatrist does. We're actually having you back next week, I believe, to go a bit more in depth about specifics, questions that people might have. So
a bit of a
really
Q&A.
Looking forward to that one as well. So thanks a lot, Sophie. Really appreciate it, and thank you, listeners.
Thanks for having me.
Well, thanks everyone, and we'll see you next time.
Cheers. Thank you for joining us on the Comfort Walk and Talk by the Comfort Co. If you like this episode and you got something out of it, we would love your support with a 5-star review on Apple Podcasts and Spotify.
Don't forget to subscribe on your favourite channels and never miss a step on your journey to comfort.
Please follow us for more insights and updates on the Comfort Co social media channels. Until the next episode, see you later.